On today's part 2 of our special series on stroke, we are joined by Dr. Stephen Corral and Renee Cruikshank, who will reveal all the treatment options available for the different types of stroke, including rehabilitation and lifestyle changes. It is crucial that not only are strokes recognized early, but treatment is started as fast as possible, as this can save your life and improve chances of recovery. In fact, did you know that the earlier the treatment is given, the greater the effect? We at What's Up Doc, in partnership with the community hospital, hope that this special series on stroke underscores the importance of recognizing early the signs of a stroke and the need to get your loved one to the nearest hospital in the shortest time possible for urgent diagnosis and to start life-saving treatment. Feeling tired or stressed? Vitamin B5, also known as pantothenic acid, is essential for turning food into energy and helping your body handle stress. Energy production. B5 helps convert carbs, fats, and proteins into energy to keep you going all day. Stress and hormone regulation. It supports your adrenal glands, helping produce stress-fighting hormones like cortisol. Healthy hair and skin. This vitamin keeps your hair shiny and your skin glowing. Where can you find vitamin B5? Avocados, a superfood packed with nutrients. Eggs and dairy, cheese, milk, and yogurt. Whole grains, brown rice and whole wheat. Mushrooms and nuts, natural sources of energy. A B5 deficiency is rare, but too little of it can lead to fatigue, irritability, and even muscle cramps. Stay energized and stress-free with vitamin B5.
As always, we appreciate you starting your day with us. Let's get into this morning's first conversation.
Is the country's healthcare system more at risk more than ever?
Why it has remained unaddressed for so long.
Political parties get lots of cash, big cash from financiers, and then when they get that now, you can't account for it.
But it's really the specialist nurses who we are in a greater shortfall for.
We can tap into the resources and have them, at least form some mentorship programs.
Highlight our food systems, and which will attract persons from all over the world to come and experience something that actually supports the local economy.
We're lucky that we have a vibrant legal system that allows change to take place, and it's not that matters are just swept under the carpet and discrimination is allowed to be perpetrated.
A lot of people don't know that there were attempts to ban the carnival, suppress the carnival.
I am Dr. Delphina Ovid, your friendly neighborhood dentist. At Community Hospital Dental Clinic, we offer examinations which include x-rays, basic oral cancer screening, and a treatment plan. We also offer cleanings, fillings, extractions, root canal treatment, and complete and partial dentures. Remember, you don't have to brush and floss all your teeth, just the ones you want to keep.
Give us a call at 235-5479.
The Community Hospital of Seventh-day Adventist,
where good private health care is affordable.
Before you take your omega-3 supplement, check for the natural product number NPN on the label. This unique code shows that Jameson products have approved rigorous Health Canada testing for safety and effectiveness. Unlike some supplements that carry disclaimers like not approved by the FDA, Jameson omega-3 is the trusted choice, offering 1800 milligrams of EPA and DHA for heart health. Choose quality. Choose Jameson.
Right. So, Doc, we're here now. Patient has already been diagnosed with an ischemic stroke. And now we have to treat. How do we go about treating this particular patient who presents with the stroke, but an ischemic stroke?
Okay, well, this is multifactorial. And what I'd like to highlight is that dealing with a stroke patient is multidisciplinary. So you'd have met a number of physicians before, and now you're at the part where your neurologists, your medical doctors, your interventionalists, and even, if indicated, your neurosurgeons are going to be involved at this point.
Right.
So first, we will look at what time has the patient presented? How long have their symptoms started? Now, after confirming on CT that it is ischemic, then if they presented within 4.5 hours, then they may be a candidate for tissue plasminogen activator.
Right.
What that simply is clot busting, to make it simple.
Because the ischemic stroke is caused by a clot that occludes a blood vessel.
Yes, and what we're trying to do is to remove that clot in order to restore flow to the brain, in order to restore blood flow to the brain.
And prevent this from continuing and propagating.
Yes.
Right, okay.
Some patients...
I like that name, the clot buster.
That's exactly what it does.
Yeah.
It tells it as it is. Now, some patients, when they have that CT, if we're able to see a very large vessel occlusion, then these are the patients that may benefit from thrombectomy. So this is where your interventional radiologist or your neurosurgeon would do a very minimally invasive procedure to actually physically remove that clot from the blood vessel. That's correct. Now, patients usually have to present within 6 hours of their symptoms for that, but depending on other imaging findings, particularly their perfusion scans, we can extend some patients to include within about 24 hours of
So again,
presentation.
timing is so critical. The time that you bring your relative back to casualty, to be seen, to be diagnosed, and now to be treated.
Yes.
All right, so let's just say time was perfect. We got that sweet spot where the patient was brought in within 3 to 4 hours of the time the symptoms started, and we administered the TPA. Yes, what's next for that patient?
So then the patient would be on, well, it depends on how critical the patient is, but the patient will have to be stabilized and monitored.
Yeah.
And then from there...
Definitely warded.
Definitely warded.
Right.
And from there, based on whatever the underlying issue was, they may be continued on antiplatelet therapy, so most times aspirin, sometimes an additional medication may be added, clopidogrel. And again, depending on the cause of that ischemic stroke, you actually may go on to anticoagulation on discharge.
Right, so this particular patient presented with right-sided weakness of the face, arm, leg, and presented at the right time in that sweet spot, the first 3 hours since the symptoms developed. And we administered the right drugs for this ischemic stroke. We're admitting the patient, so walk us through. We admit the patient, the neurologist, the internal medicine team going to be seeing this patient, yes? Yeah, and we're going to start medication, right? So walk us through after we've had the TPA done, which you said is a clot buster.
Yes.
You're right. What are the chances of this patient reversing their disability and actually gaining functionality of the right side of her body?
So this is multifactorial. It certainly starts with one, how weak or how debilitated the patient starts at the beginning.
Right.
In terms of the TPA and or the thrombectomy, that gives the best chance of recovery, because the idea is returning flow to the part of the brain that has been lost, and you're trying to salvage what we consider salvageable brain, in turn now to improve the patient's potential function thereafter.
Because
now,
once brain cells have died, that's it. They don't regenerate.
That's the very unfortunate thing.
Yeah.
So these, and the reason why the time window is so key, it's because these are the cells that are sort of hanging in the balance.
Right.
So they're considered salvageable in the right conditions. But if they're not presented with the right conditions, then secondary brain injury can ensue, causing now this deficit to worsen or become permanent.
Okay.
Apart from the ideal medical care, this is where your in-hospital physiotherapy, speech and language therapists also play a role, because they now have to come, assess the patient. What is their speech? How are they functioning? What is their strength?
They're able to swallow.
Exactly.
Yeah.
So all these things are a baseline in order to now determine where we go from there.
And that starts together with all the medical treatment.
Ideally it should, yes.
Yes. And in community hospital, they have that, where they would support the patient via physiotherapy and speech therapy in-house, even before they're discharged. Yes?
And that's certainly the way, we'd want it to be. Because, as I said earlier, the better.
Yeah.
And then this carries through on into either they go predominantly under the rehabilitation facility, inpatient or outpatient, depending on what's needed for that patient.
Now, let's look at the other end of the spectrum. We spoke about ischemic strokes, which in this case we were dealing with. But worst case scenario, patient comes in with a hemorrhagic stroke.
Okay.
How do we manage that? What should the relatives expect now that their relative is going to go through with a hemorrhagic stroke?
All right, so CT brain shows a hemorrhage.
Yeah. A bleed in the brain.
Yes, so there's a bleed in the brain. And again, we have to stabilize, admit, monitor this patient. Depending on how critical the person is, they would either be on the ward or in the ICU.
Correct.
With these patients, apart from just the plain CT brain, a CT angiogram is also done in order to rule out any underlying vascular cause. So we want to ensure there's no aneurysm, there's no arteriovenous malformation, because those are dealt separately under neurosurgery.
Right.
For this, we're looking at the bleed within the brain, within the parenchyma that was spontaneous, that the vessel ruptured. Blood pressure management is absolutely key with these patients, because one, you don't want them to rebleed, and at the same time, you don't want to drop the blood pressure so low that you reduce perfusion and further compromise the brain and potentiate brain injury.
Right.
So surgery is not a routine part of these patients' management, neither ischemic nor hemorrhagic, but there are certain criteria that we may consider surgery in. Now, specifically dealing with the hemorrhagic, blood can get into this natural fluid-filled system called the ventricles. So you produce your brain spine fluid, your cerebrospinal fluid, or CSF, every day. It's produced in one part of the ventricle, and it has to run through the channel and absorbed in another part of the brain.
Right.
Acute blood or fresh blood in that system sometimes perverts that balance between production and absorption.
Right.
So if the CSF actually is not able to flow out to be reabsorbed, then if you picture slowly filling a balloon, That's what happens essentially to the ventricles. So it's pushing against the brain, and it can cause significant changes, such as drop in level of consciousness.
Right.
Where what the neurosurgeon will do in that case is place a tube, what we call an external ventricular drain, and the brain fluid is drained externally outside of the body. So we control that drainage until that person is able to now do so themselves, because the blood eventually moves away.
Yeah.
And so we're actually able to remove that tube, or if they don't get back that balance, then they may need a permanent internalized tube to help them drain that fluid, called a ventricular peritoneal shunt.
Right.
In other instances, the clot may be so big that it is pushing against the brain structures. There are a lot of brain shifts.
Yeah.
There's increased pressure in the head, and the brain is housed in this rigid box called the skull. That presents a problem as well. So what we do now is we open the box. So a large part of the skull is removed to allow the brain its room to swell, and it does the healing on its own. We just provide the necessary conditions for it to do so. And that's how we would address that issue. Similar with the ischemic stroke, we don't really operate on these patients a lot, but with that type of insult, you can have a lot of swelling, or what we call edema in the brain as well, where if we're not able to manage that medically with hyperosmolar therapy, then we now have to open the box to give the brain the room to do what it needs to do.
I get you. And it's so critical that I think the viewers need to know the significance of having that urgent CT, because the treatment for ischemic stroke is different, totally different from the treatment of a hemorrhagic stroke. In fact, if you give a clot buster, the ATP, to a patient with a hemorrhagic stroke, you're doing some significant damage.
Certainly.
You're making things worse. So it's really important that that patient gets quickly to not your GP office.
No.
Right.
To the emergency
Not
room.
health center, but to a tertiary healthcare facility with a CT scan machine that is operational and can deal with supporting patients like this.
Certainly.
Right. Doc, before we go, if there was one piece of advice, one golden nugget of information that you would like to leave the viewers out there concerning treatment management in the acute phases of stroke, what would that be?
So that certainly will be one, recognizing the stroke in a very timely manner. I like to use this mnemonic, FAST. So if you think your relative is having a stroke, F for face. Ask them to smile. Is it uneven? Probably a stroke. Ask them to lift an arm. Maybe they're not moving one side of their body. In terms of the S, speech, is it slurred? Then T, it's time to get the patient to a tertiary facility in order to start treatment. It's all about time, and then we take it from there.
Lovely. FAST. F-A-S-T.
F-A-S-T.
Face, arm, speech, time.
Yes.
Thank you, Dr. Cruikshank.
My pleasure.
My name is Dr. Stephen Carroll, the CEO at Community Hospital of Seventh-day Adventist, and we are committed to making good private healthcare affordable.
For all your medical needs, including dental, radiology, laparoscopy, behavioral and mental health, along with many other services, contact us for more information at 235-5479.
Community Hospital of Seventh-day Adventist,
where good private health care is affordable.
Before you take your omega-3 supplement, check for the natural product number NPN on the label. This unique code shows that Jameson products have approved rigorous Health Canada testing for safety and effectiveness. Unlike some supplements that carry disclaimers like not approved by the FDA, Jameson Omega-3 is the trusted choice, offering 1,800 milligrams of EPA and DHA for heart health. Choose quality. Choose Jameson.
So, Dr. Carroll, we're following this particular patient who just had a stroke just recently, and she's still a patient of this hospital. And what's unique about Community Hospital is they offer a comprehensive stroke center for rehabilitation. So from the time she's admitted to full recovery, can you explain exactly what we're seeing here at the stroke center?
Okay, thank you very much. I think what we offer here at Community, which is a unique feature, is that we have the only inpatient rehab facility in this region outside of Cuba. And so from the time the patient is diagnosed and we're on the recovery phase, in this facility we are able to do physical therapy. As you could see, patients are here receiving the kind of treatment that will help to regain strength, balance. That's what the physical therapy component is about. Then they also would receive occupational therapy, which is about the things that would help you do your tasks for daily living. Changing your clothes, combing your hair. That's different to just strength.
Right. They have to relearn all of this.
You have to relearn how to drink from a cup. So the occupational therapy is about getting you back to your function, not just the strength and the motion. Right. And then there's also a need for speech and language therapy, which is all done in-house before they go home.
So what are we seeing here is the physiotherapy, the physical strengthening and coordination right now.
That's correct.
Okay. Every single patient who has a stroke will receive this sort of rehabilitation care?
Yes, Doc. And the reason is important that you have it in a timely manner after the stroke.
Yeah.
The best recovery.
Why is that?
Well, the best recovery by the evidence as we have in terms of literature, if the rehab starts immediately after the stroke and you have multiple sessions of OT, PT, and speech and language, it is correlating highly to good recovery. Good. If you start
regaining that original function,
that you get closer to your original function than if you start the therapy weeks or months later. Absolutely.
Okay. So, as you said, OT being occupational therapy, PT, physio that we're seeing here, and ST, speech therapy. So they're learning how to speak, because a lot of them
they have aphasia. They lose the ability to speak and pronounce certain words.
Their motor skills, so moving their lips and their tongue is difficult.
Correct. So that has to be relearned.
And all this is done here?
Right here. We have OT, PT, speech and swallow right here.
When is it that you would say patient is ready for discharge then?
Most people feel that the timeline between the actual stroke event is about a week once there's recovery and there's no evolving or ongoing stroke, as long as the person is stable. Mm-hmm. That is when you should start the therapy. You may not start the therapy day one, but once you start, it's best done for about 3 to 4 weeks.
A lot of patients who've gone through an episode like this, a stroke, they would be in hospital, be discharged, and they would have, oftentimes, their relatives would have to scamper to find physiotherapists, speech therapists, and so on. Yes. And in the meantime, because of cost restrictions, they may, their muscles, if they're not using it, they lose it, so to speak.
Yes.
And it makes it even harder for them to gain back their life, their original life, right?
Yes, that's correct.
A lot of them, as a result, suffer from some emotional issues. Mm-hmm. And I understand that your hospital offers support for that as well, a very important aspect of these patients' recovery. Can you explain?
I think that is one of the additional secrets of the hospital. We actually have a department that is behavioral and mental health.
Oh, okay.
That department is actually, it's staffed by 2 full-time staff, and it provides the patient who had a stroke the ability to have a conversation to deal with some of the natural consequences, including depression. Yeah. It is well known that a complication of a stroke in terms of mental health is that people get depressed. Somebody who was a provider, taking care of their family, suddenly can't move their arm. I mean, that is sometimes traumatic for both men and women.
Right.
So the mental health therapy is good. But there's another side of it that has to do with your cognitive. which is your
Explain
memory.
that.
Yeah, you know, so there's some memory loss after a stroke. So some of the therapy is not just about mental health, so to speak. You need a portion of that to be the cognitive part, to deal with the memory loss and some of those issues.
And those are things that would continue even after discharge, right? So the patient is home, they'll come back to clinic, so to speak, on a regular basis. How often should a patient come back for physio and OT and speech therapy?
I would tell you what is the ideal.
Yes.
The ideal would be if they had a stroke, recover, and there's no continued, evolution. 1 week after, you could start intense therapy in-house.
Right.
Let's say the stroke occurred and they came to community. Ideally, after the recovery, they should stay for like about 3 weeks and then be discharged and follow up once a week.
Yeah.
If they had a stroke outside of here, the person was discharged from the hospital, the family could reach out and they could come to community. And in particular, if the window is within a 2 to 3 week period, they'll be admitted for a 30-day rehab cycle, speech and swallow, OT, PT, cognitive and stuff, the whole process.
And again, just emphasize or just underscore for us the importance of time. So the time from between the event to the time you initiate regular, consistent physical activity, whether it's speech or motor skills, is crucial in their recovery.
Yes.
Yeah. What's your recovery rate like?
I think our recovery rate is good because we have had our first patient came to this facility on the 1st of September 2023.
Okay.
And so we've had a little bit of time to develop a little muscle memory and see some patients. And we've had some amazing stories.
Yeah.
But it's all in line with what you suggested. If the timing is good, it's not going to work as well if you had the stroke 6 months ago and then come for inpatient.
Right.
But if you had the stroke within a week or 2 or 3, and then you have therapy, we see amazing results. The recovery is really good. I don't have a percentage, but I know it's way better than you would have if you didn't come for that therapy.
If you are stuck and you have no idea what to prepare for the kids for school, to take for lunch, why not try a Greek-inspired pita pocket? Chef Emmanuel is here to show us how simple and easy this nutritious meal can be prepared.
Fluid retention occurs in the lungs and they get short of breath, particularly with exertion. And it's a particularly condition where when lying down, they feel short of breath and have to use a lot of pillows. That's a sign that the shortness of breath might be due to heart failure.